The goal for our practice is to provide the highest level of oral and facial surgical care in a welcoming, comfortable environment that patients are comfortable in and can understand the value of their care.
I usually find some type of something to connect with them, whether it's knowing them from being local here or their job, or I just find something in common, or just let them talk about themselves.
This was the first time I really noticed that a doctor spent the time with me and wasn't focused on what he had to do next, because I was nervous about the procedure, and he made me feel very comfortable, made me feel like he wouldn't rush through the procedure at all. If there was anything I needed, he made it seem like it wouldn't be a burden to him.
We spend a great deal of time treating our patients as if they're family. We like to bring patients in and everybody is comfortable, and we would extend the same level of service to our family members as we do to the patients in our practice.
Oh, everybody was very supportive and great. I was fearful that when the endodontist stated to me he couldn't do bone grafting, I was fearful it couldn't be done and that I was at a loss. I knew I didn't have the bone, and that bothered me. When I came here, the staff and the doctors assured me, we can take care of all this.
We really try to stay on the cusp of the latest and greatest technology. The field of dentistry and the field of oral and facial surgery is always changing, and so we have to always be one step ahead and always be able to offer our patients the latest technology, the latest evidence-based practices to ensure that they have the most optimal care.
Yeah, he took an x-ray of my teeth before we ever did anything, and when he got it on this screen where I could see it, it was wild looking. It shows you exactly where, and the measurements where to put your implants, and he knows where to put the anchors and the dentures, and it's all fits together like a puzzle.
He knows if something doesn't go quite right, he knows how to fix it. And that's major to me. And the technology is changing, and I want to make sure I'm with somebody that's on the leading edge.
We do wisdom teeth extractions, we place implants, jaw fractures, we do everything, facial cosmetics. Oral surgery is just so interesting because you can make somebody have a whole new smile.
When he does any procedure with you, he calls you up the night of the procedure, check to see how you're doing, see if there's any problems. I got his personal phone number. If I ever got a problem, I can call him. And he's not focused on just the dental aspect of it. He's really into your family life and what goes on outside this office.
You know, being able to look at somebody's face or mouth or teeth and be able to create that vision of what is ideal and work within the norms of that person's skeletal structure and craft and mold and create something that's beautiful, and to appreciate that natural beauty that everybody has in them. That's really what it's all about. There's nothing more rewarding than having a patient have that aha moment, or that moment where they didn't know that this was possible, or they're so happy with the results that they've got, or getting them out of pain, or whatever it is that makes them satisfied, and they get it and they look at you and they're grateful and they're thankful. There's nothing more rewarding than that.
I had been self-conscious all my life because of the cleft lip and palate and scarring. This was a choice that was pretty important to make so that I could feel good about me. And I'm glad I made it.